There is a catastrophic shortage of essential items like food, fuel, medicine, and cooking gas. Prices are rising almost daily. People are forced to wait in long queues, hoping to buy whatever is available. For example, a paracetamol tablet that was 50 cents earlier, they say now costs 5 rupees. That's 10 times more. More than 200 essential medical items and vital drugs are said to be in short supply, from paracetamol, cancer drugs, bandages to anesthetics. I heard a medical doctor had to wait in a fuel queue from 6 o'clock in the morning to 6 o'clock in the afternoon. When he finally reached the pump, the price of fuel had already gone up. The government now appears unable to pay salaries of its employees. Everybody is grappling with food shortages, not only imported items, but even domestically grown produce, due to an ill-conceived attempt to switch to organic agriculture overnight. People say that this is a manufactured disaster.
Yeah, it does sound absolutely dire there on the ground. How do they feel with the fact that there just doesn't seem to be any end in sight?
Yeah, now, for example, we are receiving almost daily requests from the Sri Lankan medical fraternity. Certain medical equipment is being reused despite the huge risk of disease transmission. That is what the medical doctors say. However, many people here overseas, they are reluctant to provide funds directly to the government because they think there are certain issues. No parent in Sri Lanka wants an infant to die, anywhere in the world, just because they can't find the medical necessities. That is why we from across Australia got together and established this Save a Dream initiative to save parents' dreams by saving the lives of newborns. We work in partnership with the Rotarians in New South Wales and in Colombo, Sri Lanka Medical Association, and the Ministry of Health in Sri Lanka. We have already provided a stock of medical supplies, including endotracheal tubes and nitric oxide gas cylinders to help babies breathe. Each cylinder costing $2,200. We want to do our best to help people overcome this terrible crisis.
Lionel, we know too that the Sri Lankan community, there are deep divisions, or historic deep divisions within the Sri Lankan community, whether in Sri Lanka itself or the expatriate diaspora as well. How are you able to put aside these differences in order to try to help out those who are in need in Sri Lanka?
Well, Australia has over 130,000 Sri Lankans now. Or Sri Lankan Australians, I would say. They are Sinhalese, Tamils, Moors, Burghers, Malays, Chinese, and so on. Due to conflicts in Sri Lanka, we are also fragmented. But on several occasions, many Sri Lankan Australians have come together as a team, working as an inclusive and united community. We were able to rise above our differences to help those in need, not only in Sri Lanka, but also in Australia. We have always ensured transparency and accountability in our transactions. We have a history of collaboration between multiple associations and individuals in Australia in delivering much needed medical equipment to 3 major hospitals in Sri Lanka. We help to save many lives, improving healthcare responses and keeping the health system in Sri Lanka in a state of preparedness.